Starting from the core of tissue processing, so the tissue, a frequent request is how is it possible to deal with different kind of samples? We will see it in 3 different aspects, supported also by photos of real problems that we received. If a fatty sample is not correctly treated, problems are present during the cutting of the block for sure. Section may present holes, and also the tissue tends to separate from paraffin and expand in the water bath, like we can see in this image. And also very important from the microscopic point of view, we can see the adipose tissue as a dense adipocytes network. So the question is how we connect to try to optimize the laboratory workflow. This sentence is taken from an article published on Annals of Diagnostic Pathology. Starting from the first sentence, more cassettes processed during a specific time. But what do I mean for a lean workflow? It means several short runs during the day with thin samples and biopsy, and the longer process for thick and fatty tissues during the night. In particular, the question that we usually receive is to use a reliable alternative to xylene. Why this? Because xylene is commonly used as a cleaning reagent, but this substance is toxic, and a long-term exposure to xylene affects the central nervous system. The isopropanol that we use is pure isopropanol, so 100, and usually we suggest to use isopropanol until it reaches the 98% of purity. And regarding this, a big advantage that Magnus has is that we have inside the unit an alcohol sensor that tells us the purity of the alcohol that we are using, and so also when it's time to exchange the alcohol in a more precise way.